You see, whenever you talk about or read about bicuspid aortic valve, you can imagine this to be a door that is defective. When I say the door is defective, it means that when the left ventricle is pumping blood into the aorta, less blood is going out. So when I say less, it means it's behaving like stenosis. But then the problem is if the door will not open properly, it will also not close properly, and therefore you can notice defective coaptation of leaflets. If the leaflets will not coapt properly, the blood of the aorta can leak back into the left ventricle, causing overloading of the left ventricle and a possible heart failure as well. If you look at a normal valve, the valve leaflets are coapting perfectly. I mean, in a normal person, not a single drop of blood will ever leak from our aorta back into the left ventricle. But here we are having a substantial volume of blood that can contribute to either left ventricle failure or left ventricular hypertrophy. Now, when would you have a heart failure or when would you have a hypertrophy? I'll be explaining to you during the course of this video. Let's look at the hemodynamics. Obviously, the first atria have to do their job, and atria contribute about 30% of filling of blood in the ventricles. Now you can see aorta blood is going in the ventricle, and this is when the problem will begin. When the ventricles of this person will contract, the contraction of the ventricle is going to result in blood to go in the aorta. But then, whichever blood is present in the aorta, a substantial volume of this is going to leak back, as you can see, into the chamber of the left ventricle. If it is going to be an acute event, then there would be left ventricle failure. If this is going to be a chronic event where little amount of blood is coming back, it will cause a left ventricular hypertrophy. So the message at this moment is, because of this leakage of blood back into the chamber of the LV, there would be a development of an early diastolic murmur. And let us now just focus on how this early diastolic murmur sounds like.